An ITV News investigation can reveal the NHS in England is spending more than £500 million a year, keeping more than 2,000 people with learning disabilities and those who are autistic locked up in hospitals. We can also report almost half of those patients don't need to be in hospital at all. But a lack of funding to give them a life in the community means they remain locked up indefinitely. The government had promised to cut the numbers of those locked up in half by 1st of April this year, but we can now reveal that they will miss that target and they are 6 years behind schedule, as Peter Smith reports.
For 10 years now, Sarah's daughter has been kept locked up in hospital. We're choosing not to show her face or name her. It's not that Sarah's daughter has done anything wrong. She isn't serving any kind of sentence. She was born with a learning disability, and it's now a 2-hour drive for her elderly parents just to see her, and visitations are restricted.
She's being punished for being herself.
For having a disability?
For having disability.
When Sarah's daughter first went into hospital, it's because she needed help. Now, she can't get out. In fact, she was clinically cleared for release 2 years ago.
You're in hospital to get better. You're not in hospital to be kept. It can't be cured. She needs support in the right environment, and the hospital is not the right environment.
Her daughter just needs a suitable place to go and some carers to support her. Then she could live freely in the community, close to family. But our society is not providing that. Lack of funds, Sarah is told. So her daughter remains locked up indefinitely.
I don't know what goes on. I'm not known for 10 years what's actually going on behind those gates. If somewhere isn't found for her very, very soon, she's going to regress and remain in there for the rest of her life. God forbid.
The system that is keeping her unnecessarily
Yes.
is also breaking her.
Yes.
And that would mean a lifetime potential with no release date in this secure hospital.
And the financial costs behind that must be enormous.
We have now investigated the money being spent on this, and Sarah is right. There are more than 2,000 with learning disabilities and autistic people currently locked up in hospitals across England. From data ITV News has obtained, we can report it costs more than £500 million for just 1 year. The NHS pays for this, and on average, current patients are being kept locked up for almost 5 years. Following an NHS England review last year, we reported almost half don't need to be in hospital at all. Based on our Freedom of Information requests, that would mean £18 million a month is spent from the NHS budget, locking people up whose needs could be met in the community.
We have a huge waste of public money going on buying the wrong kind of care, institutionalising people, placing them in a position where they're subject to restrictive practices like being over-medicated, kept in isolation, subject to physical restraint, where people are left damaged and traumatised.
NHS England told us in a statement they've increased their investment in community support and they're working hard to ensure patients are discharged safely. But in a series of investigations, ITV News has already highlighted this scandal of people inappropriately locked up, sometimes sedated and kept in solitary confinement. The government promised to address this and set a target. By the 1st of April this year, the number of people with learning disabilities and autistic people locked in hospitals was to be cut in half. But we've analysed the data and we can report that not only will they miss their own target, the current trajectory tells us they will not get there until June of 2030.
These are often people who've been in hospital for many, many years, and just simply discharging them to the community is not a simple process. But for each and every one of those patients, we have plans in place on how to get them discharged.
But there is another way.
So this is a crash pad.
The Black Country in the Midlands has introduced a new service with a mission to keep vulnerable people out of hospital. This is the crash pad, where someone who previously would have been hospitalised can be supported in their community.
Through just a bit of time and support and understanding, we can bring them back down to baseline.
Is it more often than not that someone can be supported without hospitalisation?
More often than not. More often than not.
Daisy is autistic and is thriving now while being supported to live in the community. Previously, she was one of the number locked up in hospital, where she wasn't allowed to do the things she does now, like cook for herself, or even wash in privacy.
A lot of the time, no, you can't shower by yourself. Someone has to be supervising you.
Is that demoralising?
Very, very undignified. makes you feel very undignified.
Daisy is now able to tell us what life was really like for her behind the locked gates.
I've been ignored whilst I've having a meltdown and just been stepped over and walked past. I felt very distressed a lot of the time and isolated and lost because there just wasn't the staff there to support me and make me feel better. I was having a meltdown and they didn't understand, so instead they just sedated me.
And you realise now when you're out thriving in the community, you're not sedated, you're not ignored.
No, I'm just me. I'm just being myself. I don't feel like just a number here. I feel like me. I feel like who I am.
And you don't want to go back to hospital?
No, never.
Daisy now goes to college and lives at home. The support she needs comes to her. The Black Country, where she lives, was previously highlighted as one of the worst performing in England for hospitalisations. Now, it's held up as an example of good practice, where vulnerable people are part of their community, like in this cafe. Not only is this more humane, it's also cheaper. The cost of keeping one person locked up in hospital for a year now funds an emergency response team here that's helped keep more than 50 people out of hospital in the last year.
Lots of people who would have come into hospital previously now aren't coming into hospital because we can get to them at the point of crisis. We can send the emergency response team in, we can offer the crash pad, we can send our clinical teams in, our intensive support teams, to wrap support around the person and make hospital not the foregone conclusion that that's where someone's going to land.
The Black Country here was failing. You were bottom of the league tables for the number of people in hospitals. You're now near the top for improvement. Are you showing that there is an alternative here?
Definitely, and our families tell us it's working.
What's happening in the Black Country is still the exception. Meanwhile, so many parents like Sarah must keep waiting, writing letters, pleading for her daughter's release, while she continues to languish behind locked gates, with no end in sight. Peter Smith, ITV News.
But then, Peter, what is it going to take to get more of the impact that you saw in the Black Country being rolled out elsewhere?
That's the thing. I think a lot of people will be shocked that this is a scandal they believed was confined to Victorian Britain. No one actually defends this, not the government, not the NHS. In fact, NHS England have given us a statement saying that they are increasing investment in community support to enable more people to receive personalised care in the community. They want to make that change, and yet here we are with, there are people, of the more than 2,000 people in this situation, there are many of them who need that care and they are entitled to that mental health support. But when we're talking about 41% who could be in the community, £18 million a month being spent locking people up who have no need to be there, let's just put that in some context. Can you imagine that we told people in this country that we haven't built enough schools, so 41% of the children just won't be given an education? There would be a scandal at that. This is taxpayer funded. And when we see this happening to people who either can't speak for themselves or their voices are not being heard, that's when the onus falls on our journalism and everyone in our society to call this out for what it is, a scandal that has no place in our society in 2024.
Absolutely. Peter, thanks very much.